I'm Harper Jean.
And I'm Jay.
We're here to tell you why 2017 is the best time ever for transgender people to enroll in health insurance.
That's right. January 31st is the deadline to enroll, and it's really important for you to get healthcare coverage that covers all of your healthcare needs. We're sure you have questions about Obamacare because of the new president and Congress, not to mention a recent court case out of Texas that some of you may have heard about. And we're here to answer those questions.
So, one of the most important things that trans people need to know is that Obamacare bans gender discrimination. And last year, the Department of Health and Human Services put out rules saying that means the law bans discrimination against trans people all around the country. The rule also says that insurance companies cannot have broad exclusions for transition-related care. That is huge. And it also said that plans have to come in compliance with that starting January 1st of this year.
Even better, we're pretty sure that almost all of the plans on healthcare.gov have already removed those bans on transition-related care. Our friends at Out to Enroll surveyed 850 plans across 16 states and found that the vast majority of them had already removed those exclusions. And what's even better than that is that 1 in 5 explicitly said that they would cover some or all transition-related care. Now, Out to Enroll couldn't survey all 50 states, but we're pretty sure that other states are on the same track and that most plans in general don't have those bans anymore.
So, some insurance companies might still try to refuse coverage for certain treatments. And some people may have to fight hard still with their insurance companies to get access to all the care that they need. Here at NCTE, we are going to keep fighting until no one needs to struggle to get access to the care that they need. But still, this year more people than ever are going to have the opportunity to access coverage for transition-related care, and that's why we say that these plans available between now and January 31st really are the best ever for trans folks. And you can go to outtoenroll.org to find transgender consumer information guides for plans in those 16 states Jay just mentioned.
Yeah, wow, that is awesome. But what about that recent court ruling out of Texas? Didn't it block the federal rules? I mean, how does that affect all of this?
I know hearing that a judge blocked the rules sounds bad, but it's not as bad as it sounds. First, it's a temporary order that could be reversed. More important, the part of the law that bans gender discrimination is still in effect, and the ruling does not stop individuals who've been discriminated against from going to court. So if a health insurer denies me care, I can reach out to a lawyer, maybe with one of the LGBT legal groups, and write a letter threatening to sue. And in some cases, that's enough to get insurance plans to do the right thing.
Wow, that's a lot. Is there anything else folks should know?
There's one other thing that's important. If you sign up for health insurance for 2017 with a plan that hopefully doesn't have a trans exclusion, the plan can't just go back on that mid-year and try to deny you care that's supposed to be covered under your plan. You bought that plan like you buy anything else, so they can't just go back on it. If they try, there are things that you can do, and we'll be putting up a new detailed resource soon that outlines what you can do and how to understand the healthcare appeals process. So look out for that.
Yeah, that's great. So another question. I know that DC, where we are, and 18 other states have their own laws preventing discrimination in healthcare. How do they play into all of this?
Well, those state protections are really important. They're also a big part of why plans this year are the best ever. They provide another level of protection and another place that people can go if their plans do something that's discriminatory.
That's great. And I know we just put out the report of the U.S. Trans Survey not too long ago, and it showed that half of respondents who requested that their insurance companies cover transition-related surgeries in the last year got them covered, and 3/4 of people who requested coverage for hormones got that covered as well. And that was in 2015. So With all of the improvements at the state and federal levels, that number is bound to be way up this year. So, all in all, it sounds like folks should expect more from their insurance companies this year.
Definitely. But it's also important for us all to demand more from our healthcare. And that's why we're going to be putting out soon those more detailed resources for just in case people need to appeal.
But wait, one last big thing. What if Congress repeals Obamacare?
Well, as you know, we're working really hard to stop that from happening. But the bottom line is, Obamacare is in effect for 2017. Even if Congress repeals or changes part of the law, it will still be in effect for coverage for this year. So no matter what, now really is the best time ever to get the care you need.
That's right, but you can only take advantage of all of these great protections we've been talking about if you sign up for healthcare. So enroll by January 31st at healthcare.gov.